Thank you very much. Good morning, everyone. So it's my great pleasure to be here to do the perspective for this session. Thanks for the organizer for inviting me. So I'm going to ask the question that I've been asking for the past 2 days to many of you. How do we turn all this great work that you've produced into practical decision-making and concrete actions? And this has already been the case. We've seen it with many of your presentation and Esther wrap-up, that your work is being used to take decisions to fight ongoing pandemics, but how can it be used to prevent the next one to come? So we've seen in this session and in the previous day and a half already that the epidemiological modeling is very important, not only to better understand risk, but also to be able to predict its dynamics. We've seen the importance of the One Health approach, and we've just seen it with the availability of using covariates and looking at environmental data. So it is possible, you make it possible that we can use all this data to better inform decision-making and modeling, including sociological data, gender data. We've also seen that it's highly important to be able to access data in wartime, to run the model, the wartime, so during the crisis. And that it's often very difficult, and you've highlighted this morning. But it's also very important to be able to have a plan, to have a strategy, a system, and that is what Mood is trying to do as well, is how we can integrate all this model into decision-making with a plan for quick response and action, but also prevention. And one of the main objectives of Mood that has been reminded all over the day and a half as well is the importance of being able to translate this research into decision-making and action, and the importance of co-creation to be able to do that. So there is key questions that were raised and the perspective to take out of this, and beyond the so what is how to better use this epidemiological model in peacetime. So what do we do now to make sure that all this great work is going to be available and speaking to decision makers? They speak different language. We speak a foreign language to them, and we need a translation, that is for sure. How can we ensure that it is available and accessible in a language and in a format that is giving them enough certainty? And I think that is very important. Even if we know that there is limitation to what we do, decision makers are looking for some kind of reassurance that what they're going to use is going to work. And that is leading us to how we ensure this adoption of those innovations by decision makers, and very importantly, whose role and whose responsibility is this. And I would add one more, which has been mentioned as well, just before in the Esther presentation as well, on is there any other great work being done out there globally that we can coordinate our action with to maximize their impact. So I revert to you some questions reflecting on this, and I would like you to tell me what you think. So just raise your hands according to what you think. If you think that prevention of Diease X, the next one, is important, please raise your hands. So there is a great consensus on that, so maybe not everybody. But there is a consensus that prevention is important. Keep your hands up. Sorry, I forgot to mention. It's in red. So now, do you think it's sufficiently supported and funded? Okay, so there is a great consensus on that. Not for everybody, but at least from the science perspective, we agree that it's very important. Decision makers, the rest of the world agree that prevention is important, and nobody is funding it. Do you think that the transfer of scientific finding and innovation to decision makers is important? Keep your hands up. Do you feel it's your responsibility as a scientist? Drop your hands if you don't. And do you feel it's your role? Drop your hands if you don't. Okay, so everybody agrees that it is important, it's our responsibility, but maybe not our roles. So all this set of questions, this is exactly the same kind of question and reflection we had when COVID-19 broke out, and it was a surprise for all the decision makers over the world. It was a shock that they didn't see that coming. And for scientists that have been working 20 years on emerging risk and prevention of emerging risk, it was a bit difficult to take. So we were asking ourselves all these questions. So how is that possible? And we realized that maybe we need to take our responsibility and play a role in making sure that what we are producing is being heard and is being used. So 3 institutions in France, INRAE, IRD, and CIRAD, joined forces together to write a letter to our ministries to tell them that prevention is important. Science is making innovation that can be used for decision making, and that there is a need to have a bottom-up approach to making health strategy to make sure that what happened with COVID doesn't happen again. We were lucky enough to being heard by our ministries. And this letter that was pushing a change in paradigm from response only to prevention in the bottom-up approach was transformed into an international initiative called PRESOD, which is about preventing disease emergence, and was launched at very high political level by the French presidency and the United Nations organization during the One Planet Summit in January 2021. So we were lucky enough to be able to create this big science-led initiative that can give science a higher voice at very high level and speak directly with decision makers all over the world, but also pushing local initiatives, local innovations, so that the next health strategy can be made science-based, but also relevant to the users. And this is what you've been pushing within Mood with the co-creation process, making sure that the users are at the table with the scientists to be able to define the next innovation that will be useful for them. So PRESOD is really aiming to address those important questions that have been raised with Mood, before Mood, within Mood, and after Mood. And how do we make sure that we have a common understanding and framework to be able to coordinate our response, our research project, our systems to maximize impact? How do we make sure we have a platform or many platforms, but that it is available for data sharing? And how do we make sure that all the resources are available for decision making? So PRESOD aims to address that. Within the overall ambition of following a One Health approach, taking into consideration that our health are interlinked, but also that it goes beyond health. And Wanda has reminded us yesterday with the definition of OLEP. So PRESOD wants to work with countries and with other initiatives to prevent animal-borne pandemics while still ensuring food security and livelihood of the poorest communities. So this is really pushing for the prevention and bottom-up approach in a One Health approach. And the scope of PRESOD is in the pre-emerging stage, but also looking at the spillover. And we've seen with all the work you've presented that this is where we can early detect the first sign of emergence and prevent disease epidemic and pandemics. How? What is the vision and objective? So the idea is really to better characterize risk, develop models to be able to identify risk hotspots and look at socio-economics and behaviors for risk practices and activities, being able to find solutions, co-design solutions with the people that are at the interface with the animals and the environment and at the hotspot of risk to reduce this risk, but also being able to detect the first sign of emergence with the early warning system and surveillance system as the animal, human, and environment interface. And being able to share this information with the rest of the world, research, but also surveillance, so that there could be lessons learned and you can improve the health at the national level, health strategy at national level, but also at global level. And the funding pillar, which has been also a funding key element of Mood, is this engagement of stakeholders all along the way, this co-creation process to be able to better define policies. And that was at the heart of its launch as well. PRESOD was born because of that, thanks to that, because the scientific community, but not only also the private sector, NGOs, but also donors and many academic and research institutes over the world were really aligned with this need to push a changed paradigm. And the strategic agenda and operational of PRESOD that is available on the website online has been co-designed with a community of more than 1,500 people from 122 countries. So PRESOD is an international coalition with institutional members, as I mentioned, from different type and category, not only research, not only academics, but we also engage country politically to make sure that whatever you are producing is going to be endorsed and accepted at the policy and at the national level. So we've got 27 countries, already engaged. And in terms of institution, there is more than 220 members, which represent more than 80 countries worldwide. We also make sure that we have an international governance, so that there is a representation in the steering committee of the different regions of the world and also of different type of scientific pillars represented. Very quickly in terms of activities, so as I said, so we are really pushing for translation of research into decision makings, which means a lot of work with international organizations, high visibility in high-level events, and pushing research, innovation, and change in paradigm in the different important agreements at the international level. In terms of data sharing, so we're working on a data sharing platform which allows to give visibility to different projects and programs, and we're also working on an endorsement program showing which projects are following the same values that PRESOD is promoting, so we can give them even higher visibility. And just to give you an example on how we are supporting coordination and synergy between research project and development project on surveillance activity, if I take the example of the community-based surveillance, there is a different activity implemented in all these countries listed, supported by different projects, and we are working together to make sure that the project is funding the different milestones that are required to be able to set up community-based surveillance, because there is a little different steps that needs to be taken on. And one only project cannot do it nor in its life cycle because it's too short, and nor with the budget they have because it's too little. So we are joining forces together. And that's my last slide. So I go back to you and the perspective on how can we partner with Mood? How can we support the Mood community and Mood network and innovation with this international initiative? There is different ways. One way that could be that the Mood network becomes the European branch of PRESOD, and I will explain a bit later how that could be. And the fact that PRESOD can support what you have initiated within Mood in your network, in your production, beyond the cycle of funded projects, because PRESOD is a long-term initiative. It's a coalition. It's not. There is no end. There is no. It's not a project, and we want to keep it going for the long time to really give the voice to science at the highest level. So we can support the international association that has been launched to ensure that this becomes an essential tool as well to promote science and decision within our program of long-term science policy dialogue and give high visibility and impact-based principle as well. Just to show you example on how this can happen. So for example, Belgium is one member country of PRESOD, and they have launched a PRESOD committee at the ministerial level, which is their equivalent of a 1S platform or the COVARS in France. But they've used the principle and the framework, the scientific framework of PRESOD for that. And in Australia, they are working currently on setting up a Pacific network to promote the PRESOD framework, the change in paradigm, and becoming the Pacific branch of PRESOD. So there is ways that Mood network can also do this at the European level. And we are opening the floor for your impression on that. Thank you very much.